All right, welcome to Digital Journeys. This is the first of many episodes. It's basically telling the stories of successful digital clinicians who have transitioned their way from the clinical setting into the digital realm, whether that be entrepreneurship, VC, consulting, just to give you guys an idea and feel of exactly what they've been doing. So without further ado, I've got my first guest, Bharadwaj, Chada, or Baz as he likes to be called. So do you want to introduce yourself, mate?
Yeah, hey Geeth, really good to be here and thanks for having me on the podcast. So yeah, I'm Bharadwaj, Baz. I am a GP registrar based in Northwest London, sort of clinically speaking. But then apart from that, I've sort of done a few bits and pieces in kind of health tech, health policy. Currently, alongside my clinical role, I'm Chief Medical Officer at a paediatric mental health startup called Kanjo Health. And I'm also a clinical AI research fellow at King's College London and the Maudsley, sort of building on the clinical AI fellowship, which I did last year. So yeah, really good to be here and looking forward to getting stuck in.
Yeah, so me and Baz actually, we lived together. We did F1 together. We shared the trauma. It wasn't trauma. We were in Kettering. It was great. I love Kettering. So big up Kettering. And you were always into digital health, and we did the AF Academic Foundation program together. What actually got you into the whole realm of digital health in the first case?
Yeah, so I think I'd always been interested in, I guess, things outside of clinical medicine, things outside of just, I guess, the individual doctor-patient consultation. Really, since I was in medical school, I think similar to you, I did the management BSc where, friends of ours were probably doing like anatomy or physiology and pharmacology. And that kind of sparked in me an interest in the bigger picture. So like organization of health systems, leadership in healthcare, health systems, financing, and even things like SSCs. I would always try and do things like medicine and media, medicine and literature, things, again, a little bit outside of the box. So yeah, I'd always been interested in things outside of clinical medicine. I suppose specifically the interest in health tech probably stemmed from the interest, as I said, in management in healthcare. So we both did the leadership and management AFP in the East Midlands. And as part of that, I got to do the health informatics masters at Cambridge again, which we both did together. And I think that was probably one of my first introductions into things like innovation in healthcare and trying to solve many of the problems that we face on the ground on a day-to-day basis as frontline clinicians. I think really I was trying to come at health tech from different angles. So in my F3, I had sort of the good fortune of doing the FMLM, National Medical Directors Clinical Fellow Scheme at NHSX, as it was at the time, because I wanted to learn more about the intersection of digital health and health policy. And then after that, I kind of wanted to know more about specifically commercialization and entrepreneurship in healthcare and more about actually bringing products to market. So I did a health tech fellowship in the States. And then most recently, I actually wanted to understand what it meant to deploy AI on the ground, get more of an academic or practical understanding of AI model design and development and deployment, which is why I did the NHS Fellowship in Clinical AI. So really, I'm just trying to come at health tech from different angles, different perspectives, and still just trying to figure out, I think, which aspect of it interests me the most, which aspect I get the most fulfillment from, and just kind of piecing together my career as I go along, I guess.
It's like evolving at such a pace. I mean, even when we were just doing the masters, I mean, AI was just getting started, to like when we were doing coding, remember like when we did Python, imagine if we had Chat GPT, how easy that would have been. Like
Yeah.
we just literally just type in a couple of lines and it's done. And it's just reduced, I think, the barrier to entry for a lot of these skills.
Yeah.
But I guess even when you're going from a certain angle, that angle will develop in the future.
Yeah.
Um, so the thing I struggle with is in medicine, especially in orthopedics, you have structure, and I love structure, right? You have like your clinics, and I guess people find it quite hard breaking in.
Hmm.
I know people find that out there, but I certainly do, breaking into roles in health tech, especially when it's very nuanced, but at the same time, it's evolving all the time. I don't know if you found that or what
Yeah.
kind of challenges you
Yeah,
have.
100%. I think, as you said, the space is moving so quickly and the space is becoming a lot more competitive as a result. Only when, you and I were in F1, F2, I think health tech was a lot more embryonic. And I think it was probably a lot easier to get a look in for roles, which now employers are becoming a lot more discerning. The field's becoming more competitive. And I think simply saying that I think 5-6 years ago, I mean, I feel like a boomer saying it, but I feel like 5-6 years ago, just saying you had a little bit of interest, I think as long as you could show a little bit of curiosity, a little bit of interest, and maybe a little bit of flair in a certain aspect, was probably enough to get you a look in. But now I don't think that's enough. I think you're finding that clinicians are really having to upskill themselves, develop certain special interests within health tech, whether that's like mental health or women's health, or, you know, like longevity medicine, or again, within tech, find a specific niche from them, whether that's like product regulation or product design or sales. And I think, yeah, it's moving so quickly that you're really having to find your own USP as a clinician and what you can bring. You can't simply say, oh, I'm a doctor, therefore, you know, give me a job. I think it's becoming a lot more selective nowadays.
So I guess, did you always have your identity as a doctor and want to do this on the side, or do you, like, what's your identity? Because like for me, I think we had this kind of divergence, like an F2, because you went off to do the fellowship, and I very thankfully just scraped into core surgical training.
Was like when we were living together, he lived and breathed orthopedics. I think he would spend...
Yeah, but I didn't know orthopedics, dude. Like in my first night shift as a CT, they're like, "Have you pulled the wrist?" Like, no, like.
You're being modest. I think you're very well deserving.
But like, so we had this divergence. But how did you have your identity? Were you kind of struggling with your identity as a clinician, or did you have that conundrum? Because I know I was like, even when I was even in ST3, it's not until ST3 for me did I truly enjoy orthopedics, like operating, being like, oh, this is banging. I love this. Like, did you struggle with that, or is it something you're still coming to terms with? Or is it just you can do these dual roles and you find that balance?
I think probably I would say lately, over the last maybe 12 to 18 months, I think I'm having more clarity in terms of, yeah, I do identify probably similar to what you're saying, actually, like as a clinician first and foremost. I think that's probably the strongest part of my professional identity, probably the thing that brings me the most meaning and purpose. I probably would say a couple of years ago, I didn't have that clarity. I think certainly going into F3 and especially F4, when I went to the US, I went there with the intention of possibly leaving medicine altogether and maybe looking to transition into industry full time. But actually, having been non-clinical, 100% non-clinical for 2 years, I did realize that I was actually missing it quite a lot. And I couldn't see myself being somebody who left altogether. In fact, I think a lot of the people that we know probably who have left medicine, it was from a place of real discontent, like medicine wasn't for them. You know, like power to them. If you know it's not for you, then that's great. But I think for me, that is who I am first and foremost, which is why, as I said, I came back after the F4 to start GP training.
Yeah, I was surprised about that. I was like, okay, cool.
I think a lot of people were surprised. People who were like my references and kind of mentors were like, oh, so you're back. But I think you just have to make peace with what's important to you. And for me, like I said, being a clinician does come first and foremost, which maybe is a bit of a hot take. And actually, you know, lots of clinicians like F1s, F2s are thinking of leaving. And as I said, if that's what they want to do, then, and they're clear in their mind, then great. But I would urge them to think long and hard about that, because the grass isn't always greener. And I think there is a lot to be said for being a practicing doctor.
Yeah. I think also stability that comes from medicine is a lot to say, but is hard. I mean, applying for CT training, especially registrar training now, is getting more and more competitive, as is the health tech landscape. So it is hard to comment. I think we're just talking about our experiences, and like our feelings. I mean, I agree with you. I love what I do, but at the same time, there's a period in your life where it's a bit of a swiggle, right? It's not a straight line. In terms of, you were saying about, like, the thing I struggle with is, so you have clinicians like yourself who are clinicians foremost, and you do these other roles on the side very well. But then what about the people who just, if you're competing against people who are doing those roles specifically, does that put you at a disadvantage? Or do you think that being a clinician foremost gives you that insight in healthcare? Because there are things, of course, like when you're in healthcare, you know, like if someone like gives you an idea, especially for the NHS or in the community, and you work in the community, you can be like, yeah, that's such a great idea, that will work. And then some ideas, you're just like, no, that's just going to cause extra paperwork, and that's just not going to work. I don't know what your take is on that.
Yeah, I think it probably depends on what you're wanting to go into. Like if you're maybe targeting, say, chief medical officer or medical director type roles or clinical lead kind of roles, then obviously I think being a practicing clinician, or, you know, at the very least someone who has CCT'd and had practiced at a high level for a number of years before deciding to give that up is important. In fact, I remember when in my F3 year, when I was doing the fellowship at NHS England, CCIO he is a consultant A&E doctor. And we were kind of having this conversation with him, and he was saying, like, if you say a post-def going into health tech in a clinical lead / clinical advisor capacity, again, this is probably going to be a bit controversial, and I don't want to sort of say anything that might rub people up the wrong way, but
No,
he
it's
said,
controversial because the comments of like people when
I
they
know,
tweet.
but what he said was like, if you're not sort of senior, you'll be laughed out of the room, were his words. But at the same time, like if you're someone for whom like the clinical aspect of who you are, your clinical identity is not that important, and instead you do want to completely reinvent yourself post MBBS or post F2 as someone who's, you know, commercial or sales or a founder, like many of the people that we know, then yeah, the fact that you're a doctor kind of becomes less relevant because that's not what you're leveraging. But yeah, I think if you're calling yourself a clinical expert, then I think you need to have one foot in it, is my opinion.
I guess there's a validity if you're talking to someone, if you don't know exactly what's going on. And you know, every field is so specialized. So I guess you do need to keep that foot in the door the more senior you get. But at the same time, when you are not in a junior place, you can see a broad breadth of things, I guess, because you see a lot of things from vascular to respiratory, and that's kind of the good thing about the training we get. We see a lot of different specialities, and you can tap into those because otherwise, I mean, you're telling me you're doing a health tech psychiatry
Mm.
job, and you're a GP first and foremost. Did you do a job in psychiatry?
I'm on one at the moment.
You're
Yeah.
on one at the moment, but that must surely help you in your job because you have some experience about the struggles they have, what the needs are,
Yeah.
and how that can play into your job, which is quite nice. At the same time, like if you don't know what that world is even like, it can be very hard. What are the skills you feel that translated really well into the health tech world, and what are the things you think didn't translate so well, or very different culture wise?
Yes, I think the structure or the lack of structure, I think, in startup land or in the health tech space is something that I think can be quite disorientating. I think for clinicians looking to break into health tech, and I think a lot of it requires, you know, like time management, organizing your own calendar, and a lot of inner motivation. I think the rota and, you know, like knowing where you're supposed to be on a given, you know, on a given day in clinical medicine is both, obviously it feels like a chore, and I think most of the time it is a chore, but sometimes it's a blessing as well, where you kind of are like, okay, this is my job and this is what's required of me on any given day. So I think that lack of structure is one of the bigger challenges, and I think being able to provide structure for yourself is very, very important. I think probably one of the big transferable skills is the ability to think laterally when it comes to problem solving and think creatively. And as medics, it's difficult because I think we are naturally quite good at problem solving in terms of by nature of having gone through medical school, but then also it kind of drills it out of you as well, because everything is so algorithmic and guideline driven and formulaic. And so you kind of like, especially as a junior doctor, you kind of stop thinking for yourself. And then suddenly in non-clinical roles, you know, you're expected to give an opinion on things and you're expected to advise on certain things, where as an F1 or F2, people don't really ask, like, what do you think about this? So I think that can be quite challenging as well.
Yeah.
I don't know, have you found this, like when you're doing, for example, even this podcast, right? Like it required creativity on your part. Like who do you?
100%. Like, you know, so on my digital days, I probably maybe a hot take. I think I work hard on my non-clinical days. Not because like it can be like, you know, you have an intense day on call, but like there's patients to see, I do my thing, I make a plan, you know, discussing in the trauma meeting, or there's operations,
Yeah,
there's
yeah, yeah.
whatever. Here, I feel like there's 100 different ways the day could go. And I'm like, how do I tackle this problem? There are so many problems. Like I'm doing the digital leadership fellowship. And, you know, it's doing this podcast, is it working on that app? Is it working on a piece of tech that we're developing? Is it like, how do you actually structure that day? And for me, I don't know, I read the 4 Hour Work Week. I don't know if you've read that book. I know you're into reading self-improvement books as well. And they talk about the Covey matrix, like segregating things into what's the most important and most urgent, what's important, what things can you kind of work. And I found that's what's worked for me, like prioritizing things. But I find And then taking breaks as well. I feel like I can't take a break. I feel like, that's just an opportunity lost.
Yeah.
But I would say the other thing that for medicine is it like teaches you resilience,
Mm.
because you have to, especially because, like, going through COVID, if anyone who went through COVID knows, like, if a door closes, you just need to knock on another door. You need to just pounce on the next opportunity. But what do you think? So you have like a bunch, and you've been, tackling health tech and technology in various different fashions. What do you think are the most important skills, would you say, that if I was to go into health tech afresh, that I should leverage?
Are saying that they have, rightly or wrongly, like obviously there's nothing wrong with having an interest, and I think it should be encouraged. But I think especially as the space is becoming more competitive and the pace at which it's moving, I think spending some time thinking about what is it about health tech specifically that interests you, or more rather, is it just the idea of health tech and the idea of the grass being green, and spend some time upskilling yourself in that specific competency. As I said, like when we were in F1 or F2, I think saying that you're interested in health tech was probably adequate
Because
for.
you did a lot of stuff with James Samaru, you did a lot of stuff with Somex, didn't you? You were
Yeah,
doing, because you were really good with before AI was a thing. You were really good with content writing and content creation. I remember you would sit there with your coffee or with your laptop, and I don't know how you did it whilst I was like playing video games, and you would just be like writing away, doing your I don't know if you did health tech pigeon for a period
yeah,
of
yeah,
time,
yeah, yeah, yeah,
but you were doing that kind of thing, and I think that you created a little niche for yourself,
yeah.
and you showed your flair that way. Because even like when my wife wrote just stuff, they're like, "Yeah, Keith, you can't write like this." I'm like, nope, definitely not.
No, yeah, I think that's it. I think, yeah, shout out to James. I think that was one of like probably earliest foot in the door for me in health tech. And exactly, like I really like creative writing, and so it was a good opportunity for kind of like creative writing and health tech to come together, writing basically copywriting for a bunch of their clients. To be honest, I probably still haven't figured it out now what I would say my niche is or what my interest is. Like I said, the F3 was very much policy focused. The F4 was very much like entrepreneurship and like commercialization focused. The AI fellowship was more academic and actually understanding how AI models are built and deployed. And the CMO role at Kanjo is again quite strategic. And if you ask me now to pick one of those, or which do I think I'm best at / gives me the most meaning, I probably haven't figured that out. So obviously it's a bit rich of us to sit here and say to like F1s and F2s, figure out what your niche is, when it's something that's probably evolving. But when I say figure it out, what I mean is spend some time thinking, I guess, what you're good at and specifically what aspect of it is, rather than just saying you're interested in tech in the main.
Yeah, it's sometimes I do think that as well. Was it the idea of health tech and
Yeah.
like the variety, rather than is it actually health tech, and like kind of that? It's sometimes, you know what it is. It's sometimes a cloud of being like, oh yeah, I'm into health tech, and
Yeah, yeah, yeah.
I have something else going on, versus actually, am I really good at, what do I really want to? Because I know, like for me, I'm a people person, and I know for me, when I did virtual medics with Shafi Ahmed, shout out to Shafi, like when I did that stuff and like meeting these really cool people, like meeting Google Glass, doing really cool stuff with DMind, I was like, this is just crazy, it's awesome. People ultimately want to feel valued, and if they feel valued elsewhere, that's where they'll go. Um, but there are different facets, like consulting, venture capital, and then startup world. I mean, in startup world, did you where do you feel like you've had the most exposure? Because I know you've exposed yourself to a few of the worlds.
Yeah, so currently I'm, as I said, CMO at a early like seed stage pediatric mental health startup, and that has been it's been a challenge, because I think suddenly, you do have a lot more autonomy. You're expected to make some pretty big decisions, clinically speaking, which sometimes I feel like, do I necessarily have the credibility to do that? Not saying anything that's like, obviously a question of like patient safety or something risky, but it's more just like, to give you an example, we obviously, because we're working with children, you need like a safeguarding SOP, right? Like a safeguarding standard operating procedure, like what to do if a parent or a child discloses like a safeguarding concern. And obviously as like there's the CMO, that's my job to write the safeguarding procedure. So, but initially when I was doing that, I was like, well, who am I to right, this. Yes, I mean, I have safeguarding, like level 3 safeguarding that I do every year, but this feels like something like someone like important should do. But actually it's like, yeah, I think it's just coming to terms or accepting that kind of challenge, I think, or that kind of like, okay, yeah, I'm going to have to step out of my comfort zone here and do something that I wouldn't ordinarily have to do, which has been interesting. It's also been quite fulfilling, especially dealing with people who are non-clinical by background. I think being able to translate clinical concepts in a way that kind of makes sense, in a way that they can translate, but then being able to explain how certain pathways work in the NHS, how the CAM system works, how what we're proposing could potentially actually make a difference on the ground, what some of the barriers to access or barriers to entry might be for, say, people in the area where I work, where there's a high level of socioeconomic deprivation. So I think being able to ground your perspectives from the point of view of someone that's actually practicing day to day is quite rewarding.
I mean, what does your company do? What does it actually do? Just to give me a bit of
Yeah,
background.
so we've pivoted quite a lot since I've joined. I've been with them for about 8-9 months now. Initially, we're sort of looking more to basically develop predictive modeling to identify children at risk of developing ADHD or other kind of neurodiverse conditions. Now we've pivoted more towards care coordination. So essentially, rather than parents having to individually go out and find different therapists for their child, whether that's like a speech and language therapist, occupational therapist, educational psychologist, instead it's kind of like a two-sided marketplace where we will connect them.
That is quite a big pivot.
Yeah. And part of that is obviously the challenge of accessing NHS data. So I think being more AI focused, more tech enabled is definitely the long game, but obviously we need to generate some revenue and have some money
Fine.
coming in. So this is more of like what we're doing in the meantime.
Of course, data is very hard, very siloed, as we learned in our masters in the NHS. It's very hard to access. So
Yeah, it's quite frustrating because, I know the data exists, right? Like in my AI fellowship, I'm working with vast like amounts of mental health data at South London and Maudsley, which is probably one of the largest mental health.
what system do they use?
It's so difficult. Like the number of conversations I've tried to have with SLAM, we've tried to apply, looked into like grant applications and industry university partnerships to try and access this data. But there's just so many barriers to do so. And a lot of the times the data that exists, for example, speaking personally at SLAM, it's people like myself, researchers or like research groups who are doing it for quite, answering niche questions, which are then published. But then that translational aspect is lacking. It then doesn't go into actual meaningful service redesign. And so I think if we had more established like tech transfer offices and more established opportunities for commercialization the way we do in the US or maybe in like, the Golden Triangle here, I think we would be able to see a lot more of these innovations being actually used. At the moment, it's sort of like, yeah, it's just sort of dies at the point of publication, which I think is a shame. I'm sure the ratio of like publications to innovations is probably 10,000 to 1. Yeah, I'll get off my soapbox.
Fair. I guess so. You've been to the US. You've done all these fellowships. What would be your key takeaway in terms of networking, visibility, gaining an identity, and probably cementing yourself as the person to go to?
Yeah, I think it's becoming definitely. I think networking is becoming more recognized. I think we're just seeing so many clinicians going on LinkedIn these days, where probably 5 or 6 years ago, there'd be, a handful of clinicians on it. There's lots of communities, I'm sure, you're aware of that might be of use to your listeners, things like NextGen, which James has founded, and then Doctorpreneurs, the Byte Labs Health Tech and Innovation Fellowship. There's conferences like Health and Het, and yeah, LinkedIn. I think try to reach out probably to key opinion leaders who you resonate with. And again, be specific in your ask. I think a lot of these people are quite busy. And if you just say, hey, would you be free for a coffee? That's probably, which, we've all been there. It's probably not like specific enough. But instead, if you're able to say, like, let's say you're interested specifically in medical device regulations, then you reach out to a medical device regulation consultant and say, this is specifically what I'm interested in. These are the questions that I have. Would you be free? And I think that just shows to them that, okay, this is someone who has like a genuine curiosity. I think we all want to help each other in this space, like 100%. I don't think people are like only looking out for their own interests. But at the same time, I think we need to be kind of like considered in how we reach out to people. I think the art of DMing someone on LinkedIn is an art for sure. I think if someone
I don't do that enough. I get like way too scared about like cold calling, I guess, because I'm like a people person. If I can go up to someone straight up, but like cold calling or emailing someone, it's a bit, that's a bit scary. Like, what if they don't reply? It's like, you know what it's like? It's like dating again. It's like dating. It's like being on blue tick.
That's right. It's a balance between like swallowing your pride and not overthinking it, but also not wanting to waste that person's time. And sometimes you can see, in fact, I've had a couple where it's like clearly AI generated, where they've
there's so many of this AI generated.
Yeah, they've like presumably they've like copied my LinkedIn, and then they've like copied their CV into ChatGPT and be like, what's similar between the two of us, and frame that into a LinkedIn message. And so like, just be like reasonable, I think, when you reach out to people.
Okay, cool. Any last bits of advice that you have?
I would say figure out what your equation is with clinical medicine and with health tech as well, and see where you stand on both of those aspects. And then I think that will help you to understand what kind of path you want to carve for yourself. If actually you're completely disenchanted, fed up and done with clinical medicine, then there's no point like, flogging a dead horse. Then look for, but if actually you do derive even a tiny bit of joy from it, but also you want to do a bit of consulting or something on the side, then you can probably look for fractional, advisory roles or something like that. So try and have that clarity in your mind of like what balance you want to have.
Well, thanks, Baz. Thanks for your time. We'll, I guess, see you on the next episode. But I hope that was useful. That was some genuine chit chat between the two of us and some hot topics and like people that, are still struggle with, I guess, and becoming more and more relevant these days.